myself ready.
Yes, we'll start the program right away.
So can I just brief you a bit about it, about the program? Can I just brief a little bit?
Yeah, go ahead, please.
So we have around 25 questions, and we have the meeting for 1 hour. So we hope, like in that, you will be able to answer all the questions. Is that okay, sir? Or should I cut down the questions?
Shikhar, what I suggest you is go on with the questions, and we'll see of the time factor gradually. Okay,
Oh.
and once we reach the time limit, then we will summarize. Okay.
And so I also got some photos of the awards Mr. Sir has got from from his daughter. So should I show that as well in presentation?
Yeah. So what I suggest you is first begin the program as per usual format.
Can you hear what they say?
No. Only you can hear.
I can hear, yeah.
Yeah. So now we are starting with the program.
You have okay, headphones, no, that's why.
Shikhar, you can begin.
Okay, sir.
Okay, sir. We are starting with the program.
Are you want to hear it?
Yes, I will.
Yeah, okay. Shikhar, begin. Yeah.
A very good evening to all the respected participants of this meeting. On behalf of Team Medical Humanities and Gosumec Alumni Association, I welcome you all to the virtual reunion of GSMC MBBS batch of 1948. I request the tech team to play the Medical Humanities video.
Yeah, it's coming nicely.
मला ऐकू येतंय का?
हो येते पण तुम्हाला येत नाही ना ऐकू. मग तुमच्यापैकी कोणी एक असतं आणि मग मला कन्व्हे केलं तरी चालेल ना. I don't hear. You can do it. बैस. You try again. Because नाही माझ्या फोनवर पण पुन्हा ट्राय कर ना. नाही तर सगळं खेळ खंडोबा होऊन द्यायचं. क्यों ना आवाज स्पीकर का आता है? सीधा तुला येते का स्पीकर? सीधा आता त्यांनी छटाटा मारला मोठा. जय नाना छटाटा में आया अभी. आपका स्पीकर पे आपका फोन पे आएगा. नाही पहिलं जे आहे ना ते त्यांचं फ्री हे केलेलं आहे.
Before we proceed, we would like to thank our beloved team, Dr. Sangeeta Rawat ma'am, for her support. The whole initiative and functioning of GOSUNION would not have been possible without her kind patronage. We would also like to thank our academic dean, Dr. Harish Pathak, for his support. We thank Gosumec Alumni Association for the administrative support for correspondence and financial transactions of Dr. Manu V.L.Kothari, Chair of Medical Humanities. Lastly, we would like to thank the tech team of Medical Humanities, all the respected coordinators for their guidance, and Mr. Tushar and Mr. Balu for tech support. We would also like to thank Dr. Gopal Dhadpale's daughter, Dr. Bela Dhadpale, for her help in this meeting. Now, as we all know, that our precious Twin Institute was established in 1926 and it will complete its centenary in 2026. And we would like all the batches to have a memory to look back to and cherish those precious college days. Hence, it is our mission to reunite all the batches. This gave rise to the initiative of GOSUNION. I request the tech team to show the Gosumec Foundation PPT. Gosumec Foundation was established in California, United States to give back to our alma mater, which has helped so many professionally and personally. This website allows you to enjoy nostalgic content, including history of our institution, medical humanities, archives, and much more. In this slide, as you can see, there is a web address given. At the footer of the website are the links.
I can't hear clearly.
Including YouTube, from where you can
Can
access
you hear?
This slide shows the mission of Gosumec Foundation, which is connect global Gosumecs with our alma mater, contribute to alma mater's development by sharing the three T's: time, talent, and treasure. Engage Gosumecs with the nostalgic media and enable global networking. This slide shows how to access the Google form. The objective of this form is to connect with each other and the alma mater, Gosumec Alumni Association, which is the official alumni body at Sage GS Medical College and KM Hospital. This information will be secure and later used to create a secure searchable database. Looking forward to Gosumecs supporting our mission to connect, contribute, and engage. Now, let's have a short introduction of our very special guest, Dr. Gopal Dhadpale. Dr. Gopal Dhadpale is 97, not out. He is the first MD pathologist from KM Hospital and St. GS Medical College to start two private laboratories in Mumbai. He was a pathologist for film stars and regularly had film stars like Jitendra, Dharmendra, Hema Malini, to name a few in the laboratory for blood tests. He has been a lecturer at St. GS Medical College for several years and also the chief pathologist for various institutions like Varia Hospital. Apart from medicine, he has several other interests, especially in acting. On stage, he has acted female roles when he was at the St. GS Medical College. He is very jovial, and his jokes were especially known as hats when he was studying at the St. GS Medical College. He got the privilege of working with many famous and the best of doctors while getting started. And after starting his own practice, he continues to be enthusiastic about helping people. He is knowledgeable about the medical advancements, even at his age of 97. He has won so many awards that the list goes on and on and on. So now, let's have Dr. Dhadpale. So, Dr. Dhadpale, can you hear me?
Yeah.
So, my first question to you is, why did you choose the profession of medicine?
Pardon?
Dr. Dhadpale, why did you choose the profession of medicine?
Because my sister, who was my guide philosopher, he was a GS medical student. I want to.
Please hold on.
Hello, can you hear me? Hello?
Yes, sir. Yes, sir. Yes, sir.
Yes. Please go ahead.
Because my elder sister is GS medical college.
I'm sorry, sir, you have been muted.
Voice and got muted.
इसमें आ रहा है.
Hello, sir. Can you answer? Yes, sir.
Another thing, when I was 8 years old, I was staying in Radha and I happened to accompany one fellow with a fracture of leg. And I accompanied him to KM Hospital and GS Medical College. And where I saw KM Hospital with such big wards and very clean atmosphere, that since that time I was attracted to this institution.
That's very good. Very great, sir, to know. So, sir, why did you choose St. GS Medical College only?
GS Medical is the best in the world. And I have been always thinking, if at all I go for medical college, nothing short of GS Medical College. And I worked hard. I was in Pune. I got first class in B group. And that is why I was admitted in Bombay in GS Medical College. I had to work hard. I was working for it all throughout my earlier life.
That's great to know, sir, that we are a proud GSI. Now, sir, what was your first impression of St. GS Medical College and KM Hospital?
My first impression, I fell in love with college. It was so nice. Everybody was very good. And I had going to be a nice time in the college. I got sure about it.
That's good to know, sir. So, do you have any memories of the admission process? What are they?
Hello, I couldn't.
Can you repeat the question?
Yes, sir. So, do you have any memories of the admission process when you got in St. GS?
Oh, that time admission was only on merit and no
Okay.
other things like money or any influence was ever put in. And that is why I got the admission.
Sir, what was the physical layout of the campus during your time? What changes in the buildings or structures have you seen, right?
There was GS Medical College with 2 floors, KM Hospital with 2 floors, and some other training schools, library, that side pathology or postmortem room, and blood bank, and remote quarters, and other wards.
So, sir, do you feel these changes? What do you feel about this change? Like, are they good?
I think what we enjoyed is a free, clean atmosphere. I think because of overpopulation and over demand for more and more students, the matter has become from bad to worse or from good to worse.
So, sir, do you remember the faculties we used to teach in the department while you were time? What changes do you think have occurred during your time?
Yeah.
Do you remember your teachers, sir?
Yeah.
Do you remember that? Do you have any special memories with your teachers?
No, I had short-term memory. Most important teacher in my first MBA was Dr.M.V.L.Kothari professor, and he was such a nice professor that he could take lecture over 3 hours, and people used to patiently hear him writing and wanted him to teach more and more. And other teachers afterwards, when I passed my first MBA, I remember Dr. N.V.L.Kothari, Dr. Gosumec, they are very excellent teachers and also having a very good reputation in practice.
So, sir, now my next question is: do you remember your great memories which you had in that dissection hall and those lab practicals?
Pardon?
So do you remember your beautiful memories of dissection hall and the lab practicals?
Yes, yes. Very nice. It was very nice to arrange everybody. Every teacher used to come close and teach us. And
So,
there was such a thing attractive. We didn't feel like running away. That is attractive. We all were interested.
that's great, sir. So do you remember your experiences in the library?
You remember your experiences in the library?
Library, that time, I was not very much going to the library. I was having all the books with me. But after my MBBS, I started love for the postgraduate lab. And I used to go quite often. There are two divisions, undergraduate library and postgraduate.
So, sir, what were your notable experiences when going in the wards and you encountering patients or the relatives that have stayed with you over the years?
Very many relatives. With the free access to all to any clinics which we attend, that is why whatever we wanted, we use that.
So, any learning experience that made a positive impact on your personality or your way of thinking and has been there with you throughout your life?
Several occasions, Dr.M.V.L.Kothari was very much close to me, and whenever I had difficulty, he advised me. I was very much interested in truth. And it is my attitude toward medical. In my practice, I took up pathology. Well, I was other students took up surgery. I became very nervous. Ambedkar took me to the hotel in the past and advised me, there is always a place at the top. So don't get nervous, work hard and get the top place. Accordingly, for my practice, I got to number the top of all top people like Baliga, Suratya. I was in the top of them.
That's great, sir. So, I have my next question ready, which is displays, boards, or plaques on campus which have stayed with you in your memory. Any posters, any pictures?
So I can't say about one thing, but in 1950, there was silver jubilee of our college, and Dr. Dattapai was the secretary, was my classmate, and we made so many nice things. I remember the one short of play by Raj Kapoor. Lata Mangeshkar also herself came and she gave song as Raj Kapoor accordingly acted on the stage. And secondly, Cesar by Kelkar, he was the topmost practical musician and he gave an excellent program. And we had moved all around the city in different cars. We used to spread the
Okay, that's
education achievements of our college.
that's such a great thing to know, sir. So, my next question is, what memories do you have of your fellow students, your seniors, your juniors, their friendliness, their helpfulness?
What student?
So, I was asking you, do you have any memories of your students, your seniors, your juniors, their friendliness, their helpfulness?
My best friend was Dr.M.V.L.Kothari. We were two jokers of the college and we used to enjoy that joking and enjoying laughter. There are many other students also. In my class, Dr. Kothari, Dr. Kothari, and many others. like that I
That's,
have to calculate
that's,
it.
that's amazing, sir. So, do you witness problems in studies in your own case or in fellow students because of lack of familiarity and expertise in English?
Pardon,
So my
pardon.
question, so my question is, do you witness any problem in the studies, like in your own case or in some fellow students, because of lack of familiarity and expertise in English language?
I had all career was quite good. I passed all the examinations. I got A preliminary prize. And then I took a post-graduation and I failed 8 times in final every exam. But it was for my good. I got some advantage of my failure.
So my next question is, how was the hostel life? The pros, the cons, or any
Hostel,
suggestions you have for improvements?
hostel life was most enjoyable. Although there were lots of other troubles, you see, there were no fans in the hostel. So in the hot season, we had to be almost without clothes and sleep with very little clothes on. Otherwise, the company was very good. We used to know each other very closely like a family. One day, one student called Panto. He went and I said, "Well, Punjabi," he said, "he's going to see the picture." That was called church. It was very popular picture. After he went, some other gentleman came, "Very Dr. Pan, very Pan, very Pan, very Pan." He had gone to see church and he was confused. So many examples.
We wish to have hostel life like that, sir. And so, what were the popular student hangouts in your time? What are your canteen memories?
What are the
Canteen memories, the memories you had in the hostel mess.
canteen?
Yes, sir.
Canteen was quite okay, but our mess, I was the secretary of Aryan mess, and I was to see that you get food, excellent quality food, at the cheapest rate, at 10 annas per thali. We used to give wonderful food to all our members.
That's great, sir. So, do you remember about the lectures, changes in the syllabus, the exam patterns, or any exam hall experiences?
Experiences regarding,
The exams, sir. The exam, the syllabus, the lectures.
I couldn't quite follow, but I didn't think there's an answer for this.
Yes, sir.
You can skip this question and go to the next.
So, if you were given a free hand, what changes would you make in the examination process or anything like lectures or the syllabus?
Examination, requires stress and cutting down certain other factors. Particularly, examiners should not be able to know who are the students. But if they know personally, people used to come and tell that some doctor's son is going to come first. Okay, how can they do? Of course, they are very clever, but how can they what is the method now? I do not. But that discussion always be there. The honoraries and that figure, they will get better marks in the examination.
So, which teachers in your college time did impressed you the most and left an indelible mark on you?
Pardon?
So, which teachers impressed you the most and who left an indelible mark on you? Like, which were your favorite teachers or the best teachers you had?
Oh, good. I got some very good teachers. Particularly when I started practice, I used to go to my teachers for telling them that I have started practice. Dr. Khatte, Dr. Pariga, They are my best teachers and they used to support me in my practice.
So, which were the important events which took place during your time, like debates, competition, or any guest lectures which you had there?
Competition is
Like, what were your memories like on debates? Do you had any cultural events like, or any competitive events like debates or other competitions or special guest lectures? Do you have any memories of them?
I was the member of cultural committee. I was actually in the camp of those 5 years and I had a very nice response from that committee. I enjoyed the cultural.
So, continuing this question, can you just give us some beautiful memories of our beautiful fest Avishkar or our great college band Orgy? Do you remember anything about them?
That Avishkar is outcome of our basic programs we were uh, giving to the students. And for various students, we started first time half an hour, one act play. And I acted in all one act plays every year for 5 years. And that was the first act. Then after that, Avishkar and all.
That's great, sir. So, do you have any memories of your inter-college events,
Of
of events which you attended in different colleges? Apart from SAGS, did you went for any other events in different colleges?
where we inter-collegiate drama competition, we used to take part and used to make good marks in the inter-collegiate drama. I myself teacher in prize in inter-collegiate. And many other things are also there. Actually, in every activity, Case Medical College was ahead. Even in sports, Dr. Manu used to be the captain of our team and used to be in Inter Medical College research compound.
So this shows that the GSItes are unbeatable in any field. And so, my question is, any innovations done by a batch which you remember?
Regarding admission to the college,
Anything, sir? Anything which you feel was like a good innovation which was
I
done by a
don't
batch?
think admission is very fair. Here, the money part is more influence than merit part. We should come back to the merit and give it. That is the most important thing. If money comes, it becomes a business later on in that fact. I totally am against
And so, my last question to you,
improvement. Yeah, improvement. We want to cut down this practice, come back to the fair sort of competition.
and so my last question to you is, do you have any beautiful reunion memories with your batchmates?
I got, I think that your question about what are they, all my classmates of very high moral and scholastic, very honest. Dr. M.V.L.Kothari got Padma Bhushan for his excellence, and he took first everywhere, also in the MRCB exam. Then Dr. Nair, he got actually many prizes, but he failed in one small subject, and all his prizes were not well. Then he went to America, he got PhD in geography. Manu was very much ahead in plastic surgery. He invented potato pigs for during birth, and he started a hospital at Tyrone. It is called this hospital for birth, and that is supposed to be number 2 in the whole world. First number is Japan. Thirdly, I'm Dr. Dr.M.V.L.Kothari. He started a big cancer hospital in Mokuzal place like here, and that is working extremely well even after his death. Ajanwala, he he became the plastic surgeon. He went to South, and his teaching was so good. The people from all the world, all the students used to come and learn plastic surgery under him.
So, my
Just
one,
one more, Suman Pinare, the pathology, it was very hard with Dr. Singh. And now you can see an auditorium in our memory, same Pinare auditorium.
so my one more question to you is: do you have any message for all the aspiring doctors out there? Do you have any message for us?
Okay?
So,
What is it?
do you have any special message which you want to give, or a learning which you want to give to us?
No, I can't. Hello.
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 Yes, sir. So I'm saying, do you want to give any lesson to us or any message which you want to give to all the doctors out there?
Message, always speak the truth. Follow the good principles what our religion has taught us. Have faith in God and faith in yourself. That will be good.
Thank you very much, sir. So now
Okay.
I request the tech team to play the reflection video.
Okay. Okay.
A very good evening to you all. It is indeed my pleasure to speak about Reflections on Medical Humanities, annual volume published by Dr. Manu.V.L.Kothari, Chair and Division of Medical Humanities, Gosumec Alumni Association, under the patronage of Dr. Sangeeta Rawat, Dean, St. GS Medical College and KEM Hospital, Mumbai. The first issue of Reflections was published in the year 2019, the theme being History of Medicine, Looking Back to Improve the Future. The book comprises invited essays, poems, cartoons, quiz, crossword, and articles which were published before in different medical journals on evolution of branches and development of specialties in healthcare, great personalities and inventions in medicine and healthcare overall. The issue for the year 2020 was based on interpersonal relationships in healthcare. Invited essays and cartoons on doctor-patient relationship, doctor-doctor relationship, and medical teacher-student relationship were included. For the year 2021, we chose very apt theme of COVID-19, the human angle. Essays and poems in English, Hindi, Marathi, paintings and photographs contributed by teaching and non-teaching staff and students of St. GS Medical College and KEM Hospital who shared their experiences both on personal and professional fronts during the pandemic. For the year 2022, literature and medicine is the theme. We have essays and poems in English, Hindi and Marathi, paintings and cartoons, and it will be published shortly. Now, for the years 2023 and 24, the proposed theme is Reminiscences, Our Days at St. GS Medical College and KEM Hospital. As we move towards the centenary year of our institution, let our fond memories come alive in the form of nostalgic writings about our learnings, not only medicine, but also life lessons that we learned here. Let us talk about our devoted teachers who inculcated values and shaped our lives, priceless friendships which we cherish lifelong. Our writings will instill a feeling of pride and a sense of belonging in all of us. The readers of the book, we as well as the future generations of students, will understand the power and beauty of expression and reflections. We will be enlightened about the history and glory of our institutions, past students who have contributed to the welfare of the society, and the role model teachers and mentors. We know, irrespective of the generation, we are bound by a common bond of being GSites. However, we also need to accept and adapt to changes which are inevitable following technological advances and societal transformations. At the same time, the students will learn that even though the changes are occurring, The humanitarian values and principles of ethics are unchanging. Hence, we appeal that the reminiscence and nostalgic memories shared on this platform of virtual reunions be expressed in the form of writings to be included in our next issue of Reflections. I, Dr. Swarupa Bhagwat, Editor Reflections and Associate Professor, Department of Transfusion Medicine at this institution, will be privileged to connect with the individual batch coordinators for sharing more details regarding the same. Thank you very much.
So thank you very much, Dr. Gopal Dharpale, for joining in this
Hello,
meeting. Thank
hello,
you very
Shikhar.
much. Yes, sir.
Shikhar, just give Dr. Gopal Dharpale time, okay, to speak if he wants of his own accord, without specifically answering the questions. Just
Okay,
check.
sir.
Okay, just give that opportunity, and then you can have the vote of thanks.
Okay, sir.
Okay, just check. Hello, is Dr. Dharpale online?
Yes, yes.
Yes, sir. Now, sir, you have been answering questions which were pre-programmed. Okay.
Ah,
Now
okay.
we would like you to speak impromptu of your accord, the way you would like to communicate to uh, all the present Gosumecs in particular. The way you have been communicating in WhatsApp groups. Okay, if you want to sing or you want to, meaning completely time, we still have time. Therefore,
How much time?
you
How
could
much
please,
time?
sir, as long as your energy permits.
Oh, that I'm an old man, talkative person. If you
No,
take,
no, so please go ahead. So since we have still enough time with us, okay. So you could, meaning, so far you're answering questions specifically to what was asked. Okay. Now maybe you could recall your time, the dean at the time, and then the way the nursing department was, or anything. I'm just giving you some cues. Okay. Or meaning you're very much fond of arts. You have been an active member of WhatsApp community of ours, because you are. Okay. So suppose you want to just sing a song also. Okay, that will install a lot of energy in the younger generation. So please feel free to speak of impromptu from your side, sir. And moment the time, in case there's a lack of time, we will certainly keep you informed. And then Shikhar will have a vote of thanks. And then we will conclude the program.
okay,
Yeah, please start, sir.
I will. I do not know what to talk, but I feel about we all good things that now I heard. But I would like to tell some blemishes in my life.
Welcome, sir.
Let me be very frank. And you see, I was very much interested in social service. Enthusiastically, I appeared for one boy in the university matriculation examination in the year 1944. I was got red-handed and punished with I was like, and now I appeared for appealing for 4 years. So I became hopeless. My sister came to my help. She said, don't worry, if you are here, it is not a good person. Is this? You have done it for that boy, but what you should not have done. How you tell me what you want to be in life. So I told my sister, she was saying, I want to become an MD doctor like you. It's a very good idea. Don't give it. You require hard work and hard time people. So to continue habits of studying, I joined government engineering college Pune. There's lots of work and study required. And then I did 2 years of engineering college. Then next week of way to join inter science. In inter science also, I had a gap of 3 years. after paper. That time in his group, only few patients used to come. There's somebody who were from Vegas. I worked hard in particular so that I could just admission in the college. Then one thing, another list, everything came to my use in the long run. Second thing says, then up to MD part 1, I passed without any trouble. In the party, I got one prize also. But in second MD, I failed 7 times. I failed 8 times. That time I was very examination where like that only. My friend Dr.M.V.L.Kothari, he appeared 10 times. And then my manager came of the TV level because they heard of Tata members in the third department. 10 times. But we were all good students. CATV got and in practice, before I passed my final in and I got some very good results. In the one urine examination, I found the color was that of chocolate. I investigated it and I found out to be of urea. I worked on that and presented that to Dr. R.V. Sache, whose place it was. I showed all the tests and he was extremely happy. He called me at Deja Hospital and honored me because in Deja Hospital was same hospital. In whole hospital, because there's no porphyry in US. And I inquired with anybody, nobody has seen porphyry in US. That is one thing. Operation after final anesthesia, he was giving viewers and final examination showed lot of postage. He asked people to urine culture, I mean, culture, but there are no growth. And then antibiotics also, they are of no use. It was very that's very different. If you give antibiotics, it persists you to so ultimately answer you say you are a pathologist, you tell me what it is. I went into the Portuguese library, worked out all that thing, and then I have came to the conclusion it is a non-specific irritation of the spinal cord, the spinal anesthesia. And that's the picture I presented to us. It was so good. And then I said, after 6 or 5, 8 months, automatically the patient is all right, but till then, we will go on getting this up and down thing. So something things happened. And before I got family, I was famous all over North Bombay. And very recently, I was honored by Vice Chancellor of Bombay University as an ideal personality. Same Vice Chancellor, not same, but that time who was there, had divided me, giving me honor that for 4 years, you should not, you not allowed to appeal for it. So such wonderful things have to happen if you go on working properly, nicely. Everybody makes some mistakes, but God gives him full strength to sustain it and come out with it like success. I call it a Kadanta Shobha. Okay? Anything more? बंद हो गया
Hello.
हेलो
Since you, am I audible?
Oh yes.
Hello.
Yes.
Meaning since you're fond of arts,
Yeah.
So you could entertain us with some, say, poem or song.
Okay, I can compose some good poems in Marathi. So I will. There's some picture called Tanaji came. Since my childhood, I used to like Tanaji and Shivaji. So, short poem I have published as follows. It is in Marathi, please excuse me.
No, no problem, sir. Absolutely. Go ahead.
Because so many people will not understand.
No, no problem. Feel comfortable whichever way you want to communicate.
Tanaji tried to conquer Shivmoga, but he lost his life during the war. And although Shivmoga was won by Shivaji, he had lost his great friend Tanaji. And when the light was shown on the Kundana coast, Shivaji came with great hope to congratulate Tanaji. But he found the other way, and he was very sorry. All that moment took place here. धावीने धक्का दिलावर छातीवरती वार झेलले शरण जाता मरता मरता शरण जाता लढता लढता शिवचरणावर प्राण अर्पिले शिव तानाजीची गाती श्रेष्ठता शिवरायाची अचूकले प्रभावशाली सुगंध त्याचा सिंहगडावर सदा दरवळे वंदन माझे या श्रद्धेला जोडून दोन्ही कर तानाजीचा गाती पवाडा सिंहगडाचे कंकर कंकर. That was published in a Marathi magazine for Kishore. It was for children, but it was liked by everybody in Maharashtra. And about music, my wife was extremely nice musician. She got opportunity to sing in Hawaii Ganbari Master. And in America, I had arranged the music program in 22 different places. And with her also, I had an opportunity to see all over America. We got the opportunity to sing in North American Marathi Sammelan 1985. And it was really well appreciated. Their success we got the request to sing in their stage. About 40 applications came there, but we could not do it. So many other things are there. Good things, let me say, coming out of it. In my life, it has been going on. But because of my,
Can ask you your good dates.
okay, I got out of
I can
all
ask you your birthday.
My birthday is 15 January 1926. As good as our institution,
22nd January Foundation.
20 Mahina, yeah.
1 week before.
Oh, yeah.
It has been nice interacting with you. I think I'll hand over to Shikhar for vote of thanks.
Okay.
Shikhar? Shikhar?
Yes, sir. Yes, sir.
You can proceed ahead with vote of thanks, please.
So, sir, now, thank you very much for these beautiful memories and these beautiful poems. Now, thank you everyone for joining in this meeting.
Okay, I am very much thankful to you also.
Thank you.
God bless you. Thank you.
You're blessed.
Yes.
Recording can be stopped now, Shikhar.
Yes, yes, sir, it has been stopped.
हो गया ना?